You know, there's something we've all been doing since we were kids: brushing our teeth. It's such a simple habit, something we do every day without much thought. But here's the thing: just because we've been doing it for decades doesn't always mean we've been doing it right. In fact, as we get older, some of those little mistakes we've been making can add up, leading to problems like gum disease, tooth sensitivity, or even tooth loss. And let's be honest, nobody wants to deal with that. So today, let's talk about some of the most common teeth cleaning mistakes that folks over 60 tend to make. And more importantly, how to fix them. Because taking care of our teeth isn't just about keeping a bright smile, though that's a nice bonus. It's about staying healthy, avoiding pain, and making sure we can keep enjoying our favorite foods for years to come. Now, you might be thinking, I've been brushing my teeth my whole life. What could I possibly be doing wrong? Well, you'd be surprised. Even small habits, like how hard we brush or the kind of toothbrush we use, can make a big difference over time. So let's dive in and start with the first mistake, one that might seem harmless but can actually do a lot of damage. Mistake number 1, brushing too hard. Have you ever noticed that your toothbrush bristles start to look frayed and worn out after just a few weeks? Or maybe your gums feel a little tender after brushing. That could be a sign that you're brushing way too hard. A lot of us grew up thinking that the harder we scrub, the cleaner our teeth will be. But here's the truth: your teeth don't need a heavy hand to get clean. In fact, brushing too aggressively can wear down your enamel. That's a protective outer layer of your teeth, and even cause your gums to recede over time. And once your gums start receding, it can lead to sensitivity, making hot or cold foods uncomfortable. So what's the fix? Think of brushing your teeth like massaging them, not scrubbing a stubborn stain. Use a soft bristled toothbrush. Yes, soft, not medium or hard. And gentle, circular motions. Let the bristles do the work instead of your elbow grease. And if you're not sure if you're brushing too hard, try this little test. Hold your toothbrush with just your fingertips instead of gripping it tightly. That'll naturally lighten the pressure. Mistake number 2, not brushing long enough. Now let's talk about timing. How long do you usually spend brushing your teeth? If you're like a lot of people, you might just do a quick once over, maybe 30 seconds or so, and call it good. But here's the problem. That's not nearly enough time to do the job right. Dentists recommend brushing for a full 2 minutes, twice a day. That might sound like a long time, especially if you're used to rushing through it. But it's what's needed to make sure you're cleaning every surface of your teeth properly. Otherwise, you could be leaving behind plaque, that sticky film of bacteria, which can harden into tartar and lead to gum disease. A simple trick to make sure you're brushing long enough: try humming a song while you brush. Pick a tune you love that's about 2 minutes long. Maybe a classic like Yesterday by the Beatles or Stand By Me by Ben E. King. By the time you're done humming, you'll have brushed for the right amount of time without even watching the clock. And here's another tip. Divide your mouth into 4 sections: upper left, upper right, lower left, lower right, and spend about 30 seconds on each. That way, you're giving every tooth the attention it deserves. Mistake number 3, skipping the inner surfaces of your teeth. When you brush, where do you focus the most? If you're like most people, you probably spend the most time on the fronts of your teeth, the ones that show when you smile. And that makes sense. We want those to look clean and bright. But here's the thing: the inner surfaces of your teeth, the ones that face your tongue, are just as important, if not more so. Plaque loves to hide in those hard-to-reach spots, especially along the gum line. And if you're not cleaning those areas well, it can lead to tartar buildup, and even cavities where you can't see them. So next time you brush, make a point to angle your toothbrush toward your gums and gently clean those inner surfaces. It might feel a little awkward at first, especially if you've been neglecting them, but your teeth and your dentist will thank you. Now, these are just the first few mistakes we're covering today, but they're some of the biggest ones that can sneak up on us over the years. And the good news? They're all easy to fix with just a little adjustment to your routine. Now that we've covered some of the basics, like brushing too hard, not brushing long enough, and missing those inner tooth surfaces, let's move on to a few more mistakes that might be slipping under your radar. These are things that even the most diligent brushers sometimes overlook, but fixing them can make a big difference in keeping your teeth and gums healthy. Mistake number 4, forgetting to clean your tongue. Here's a question for you. When was the last time you gave your tongue a good cleaning? If you're thinking, wait, I'm supposed to clean my tongue? You're not alone. A lot of folks focus solely on their teeth and forget that the tongue is a breeding ground for bacteria. In fact, that white or yellowish coating you sometimes see, that's a buildup of bacteria, food particles, and dead cells. And if it's not cleaned regularly, it can lead to bad breath and even affect the health of your teeth and gums. So, how do you clean your tongue? It's simple. After brushing your teeth, gently scrape your tongue from back to front with a tongue scraper or even the edge of a spoon. If you don't have a scraper, you can use your toothbrush. Just give your tongue a few light strokes. You'll be amazed at how much fresher your mouth feels afterward. Mistake number 5, using the wrong toothpaste. Walk down the toothpaste aisle at the store, and you'll see dozens of options: whitening, tartar control, sensitivity relief, herbal formulas. The list goes on. But here's the thing, not all toothpastes are created equal, especially as we get older. One common mistake is using a toothpaste that's too abrasive, like some whitening formulas. While they might make your teeth look brighter, they can also wear down enamel over time, especially if you're already brushing a little too hard. Another issue? Many older adults deal with dry mouth, whether from medications or natural changes, and some toothpaste contain ingredients like sodium lauryl sulfate, SLS, which can make dryness worse. So what should you look for? A fluoride toothpaste with the ADA, American Dental Association, seal of approval is your best bet. Fluoride helps strengthen enamel and prevent cavities, which is especially important as we age. If you have sensitive teeth, opt for a desensitizing toothpaste. And if dry mouth is a problem, choose a moisturizing formula or even a baking soda-based paste, which is gentler. Mistake number 6, neglecting your toothbrush. Let's talk about your toothbrush for a minute. How old is it? If you can't remember the last time you replaced it, it's probably time for a new one. Dentists recommend swapping out your toothbrush or electric toothbrush head every 3 to 4 months, or sooner if the bristles look frayed. Why does this matter? Worn-out bristles don't clean as effectively, leaving behind more plaque. Plus, an old toothbrush can harbor bacteria, which isn't exactly what you want to put in your mouth every day. And here's another tip. Store your toothbrush upright and let it air dry between uses. Don't keep it in a closed container. That just traps moisture and encourages bacteria growth. Now, these might seem like small things, but together, they add up to a healthier mouth. And the best part? They're all easy fixes. We've covered quite a bit so far, from brushing too hard to choosing the right toothpaste, and even remembering to clean your tongue. Now, let's round things out with the last few mistakes that could be standing between you and a truly healthy smile. These might be the most overlooked habits of all, but they're also some of the easiest to change once you're aware of them. Mistake number 7, skipping floss or not flossing correctly. All right, let's address the elephant in the room, flossing. I know, it's one of those things dentists always nag us about, and if you're like a lot of people, you might occasionally forget to do it, or maybe you think a quick rinse with mouthwash does the trick. But here's the truth, flossing isn't just an extra step, it's essential. Brushing alone can't reach the tight spaces between your teeth where food particles and plaque love to hide. Over time, that buildup can lead to gum inflammation, cavities between teeth, and even bad breath. And if you've noticed your gums bleeding when you floss, that's not a sign to stop. It's a sign your gums need more attention, not less. If traditional floss feels tricky to handle, especially if arthritis or stiff fingers make it tough, try floss picks or a water flosser. They're much easier to maneuver and just as effective. The key is to be gentle. Guide the floss in a C shape around each tooth rather than sawing back and forth, which can irritate gums. Mistake number 8, rinsing right after brushing. Here's a habit you might not realize is working against you. Rinsing your mouth with water right after brushing. It feels natural, doesn't it? You brush, swish some water around, and spit. But doing this actually washes away the concentrated fluoride from your toothpaste before it has time to strengthen your enamel. Instead, try this. After brushing, just spit out the excess toothpaste without rinsing. Let that fluoride sit on your teeth a little longer. It keeps working to protect them. If the idea of not rinsing feels strange, wait at least 30 minutes before drinking or rinsing. And if you must rinse, use a fluoride mouthwash to keep the benefits going. Mistake number 9, avoiding the dentist because everything feels fine. I get it. Nobody loves going to the dentist. And if your teeth aren't hurting, it's easy to put off that 6-month checkup. But here's the thing. Many dental problems, like early gum disease or small cavities, don't cause pain until they're serious and more expensive to fix. Regular cleanings remove tartar that you can't brush away at home, and your dentist can spot tiny issues before they become big ones. Think of it like changing the oil in your car. You don't wait for the engine to smoke before taking action. Your teeth deserve the same proactive care. If cost or anxiety is a concern, talk to your dentist. Many offer payment plans or sedation options to make visits easier. Wrapping it all up. So there you have it, 9 common teeth cleaning mistakes that might be quietly affecting your oral health. But remember, this isn't about guilt or perfection. It's about small, mindful changes that add up over time. Maybe you start by switching to a softer toothbrush or setting a timer to brush for 2 full minutes. Perhaps you'll try flossing just 1 tooth tonight. It's a start. Every little adjustment counts. Your smile has served you well for decades through laughter, meals, and countless conversations. With these simple tweaks, you can keep it strong and healthy for years to come. And hey, why not share your own tips or experiences in the comments? We're all in this together, learning as we go. If you found this helpful, give the video a thumbs up. It really does make a difference. And don't forget to subscribe so you don't miss more practical tips for thriving at any age. After all, life's too short not to enjoy every bite, every laugh, and every confident smile. Here's to your health, and to keeping that sparkle in your grin.